Hi everyone, welcome to a heart and lung health webinar surrounding pulmonary embolisms. My name is Aline and I'm here with Dia, and we'll be talking about the causes, symptoms, diagnosis, and prevention of pulmonary embolisms. So today we're going to cover what a pulmonary embolism is, what the contributing factors are, and we'll also talk about the symptoms that one may experience, how it's diagnosed, and what the preventative measurements are, including the resources available for such diagnosis. So let's begin by talking about what exactly a pulmonary embolism is. Let's first talk a bit about the pathway of blood between the heart and the lungs. Blood flows through the lungs from the right side of the heart to pick up oxygen and get rid of carbon dioxide. This process is called gas exchange. The blood then flows from the lungs back to the left side of the heart to be pumped out to the rest of the body. A blood clot is formed when a vessel contracts to slow blood loss while platelets adhere to the area and combine with proteins to form a temporary plug, or clot, over the affected area. When platelets combine with the protein, they stimulate platelet aggregation, which activates the clotting cascade. As such, a pulmonary embolism, or PE, is a blood clot that gets into the blood vessels in the lungs and prevents normal flow of blood in that area. This blockage causes problems with gas exchange. Depending on how big the clot is and the number of vessels involved, it can be a life-threatening event. In many cases, multiple clots are involved in a pulmonary embolism. The portions of lung served by each blocked artery are deprived of blood and can begin to die. This is known as pulmonary infarction. This makes it more difficult for your lungs to provide oxygen to the rest of your body. There are three classifications of clots in the pulmonary artery. Based on the location of the clots, the three classes are 1. Saddle PE, which is a large clot in the main pulmonary artery. Second is a lobar PE, which occurs in the big branch of the pulmonary artery. Or thirdly, a distal PE, which occurs in small branches of the pulmonary artery. Saddle pulmonary embolisms is the most life-threatening classification, as it can affect both branches of the pulmonary arteries. When left untreated, saddle PE is associated with a significant mortality rate of up to 30%, while diagnosed PE is 8%. If the clot is small and with appropriate treatment, people can recover from PE. However, there can be some damage to the lungs. Now that we know what a pulmonary embolism is, let's go over what can cause it. Deep vein thrombosis, or DVT, is a serious condition that occurs when a blood clot forms in a vein located deep inside the body. Deep vein blood clots typically form in the thigh or lower leg, but they can also develop in other areas of your body. Symptoms of DVT include swelling in your foot, ankle, or leg, usually on one side. Others may experience cramping pain in the affected area, usually beginning in the calf. However, the Centers of Disease Control and Prevention stated that such symptoms only occur in about half of the population who have this condition. Once the blood clot has formed, a serious complication can occur when a part of the clot breaks loose and travels through the bloodstream. People may not find out that they have DVT until they've gone through emergency treatment for a pulmonary embolism. This occurs once the loose piece of blood clot has traveled through the bloodstream and to the lungs. Over 50% of patients with DVT will eventually be diagnosed with pulmonary embolism, while approximately 70% of patients with confirmed PE have DVT. 2/3 of deaths occurring from DVT to PE are within 30 minutes of an embolic event. A piece of the clot large enough to totally occlude the pulmonary artery can quickly cause cardiac arrest. Obesity has been suggested to be a risk factor for fatal pulmonary embolism since 1927. Since then, investigations had reported an increased risk ratio for DVT and PE in both men and women. From 1998 to 2008, 1.1% or over 200,000 obese patients were diagnosed with pulmonary embolism. This is compared to a 0.6% diagnosis in non-obese patients. A past study conducted using data from the National Hospital Discharge Survey revealed that in patients under 40 years old, obesity resulted in an approximate 5% increase of both conditions. In females aged less than 40 years, the relative risk for DVT comparing obese to non-obese patients was almost 6 times higher. In males aged less than 40, the relative risk for DVT was 3.7 higher than non-obese patients. Here we have a more detailed comparison of pulmonary embolism and DVT incidences in obese versus non-obese patients based on their age groups. Overall, the relative risk of pulmonary embolism between the two categories was 2.2. A comparison study of relative risk in females versus males was also evaluated. Obese females had a greater relative risk for DVT at 2.75 than obese males at 2.02. For those aged 60 to 69 years, the relative risk for pulmonary embolism was 1.5 in women and 1.3 in men, while for those aged 70 to 79 years old, the relative risk for pulmonary embolism was 2 in women and 1.9 in men. The overall trend was that women had increased risks of both the DVT and PE regardless of the age group. Additionally, it is important to note that all age groups revealed an increased risk relative to non-obese patients with a 95% confidence interval. The confidence interval indicates that we are 95% confident that these findings are in fact true and not coincidental. In a 2019 study based on over 170,000 hospital admissions for pulmonary embolism, 34% of patients reported to be active smokers. Within the next 30 days, readmission rates for smokers was 2% higher than non-smokers. This suggests a correlative relationship between the two variables. Additionally, the relative risk for PE for women smoking over 35 cigarettes per day had a relative risk of 3.3 times higher than non-smokers. The study concluded that control of this factor can decrease risks of pulmonary embolisms as well as coronary heart disease. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease characterized by long-term breathing problems and poor airflow. A meta-analysis study conducted on hospitalized COPD patients between 2011 and 2013 examined the prevalence of pulmonary embolisms during periods of COPD exacerbation. These are periods of flare-ups of COPD symptoms. Following analysis, the results indicated an approximate 30% incidence of PE in said patients. Individuals complaining of chest pain, are obese, immobile, or have lower limb asymmetry were at a higher risk of having pulmonary embolisms. To learn more about COPD, take a look at our channel and search for the Shortness of Breath webinar. There are also genetic factors that may contribute to pulmonary embolism incidences. Factor V Leiden and prothrombin factor II are some of the various genetic factors that can cause life-threatening complications. These mutations cause development of abnormal clots in the leg or lung, which directly result in DVT and pulmonary embolisms. Specifically, patients with one genetic copy of the Factor V Leiden mutation have a 7-fold higher risk of DVT in a general population, while patients with both copies of this mutation have an 80-fold increased risk. Other more rare factors include deficiencies of protein C, S, and antithrombin 3. Proteins C and S are two plasma proteins that work as a natural anticoagulant system. Antithrombin 3 is a protein in the blood that blocks abnormal blood clots from forming. 50% of patients with these deficiencies develop DVT and PE below 45 years of age.
Hello everyone, thank you so much Eileen for explaining the causes and more on exactly what pulmonary embolism is and why it's related to the heart and cardiovascular disease. So now that we know a little bit about what it is, the background, some of the causes, let's go into the symptomology and how exactly you would know if you're experiencing a pulmonary embolism. So some of the symptoms you can see are on the left of the slide, and they're given out in a list form in this little graphic over here. One of them is a loss of consciousness, so oftentimes you'll feel lightheadedness or dizziness because you're not getting enough oxygen circulating in your blood, and sometimes that might even result in a fainting spell. Another really common symptom of a pulmonary embolism is a cough. And this cough will cause you to bend over, to stoop, and to really try to get more air into your lungs. And sometimes it might even result in you coughing up blood. Sometimes a cough can be associated with chest pain, or you could be feeling chest pain by itself. And this chest pain will be similar to the feeling of having a heart attack. It'll be a sharp pain felt when breathing in deeply and potentially felt while coughing. And this pain might not only be in your chest exclusively, it could also be in your arm, your shoulder, your neck, or your jaw. So those are things to watch out for. You might also be wheezing, and that is a symptom of pulmonary embolisms. You may also have a fever. You could also have a leg pain, swelling, or both. That's usually in the calf, and it's usually caused by a deep vein thrombosis. So that's something that Aline explained earlier on in the video. And finally, you might also experience clammy or discolored skin. And this may have a bluish hue, which is called cyanosis. And this again means that there is not enough oxygen circulating in your blood. And this is a symptom of pulmonary embolisms. So now that you know what are the symptoms, what if you're experiencing them? What do you do now? So we recommend that first of all, write down what symptoms you're experiencing, when you're experiencing them, and how long. Try to be as detailed as possible so you can give the information as accurately as you can to your healthcare provider. The second step is to go to the hospital. So call 911 because pulmonary embolisms can be fatal. They are something to be taken seriously, so we always recommend be safe rather than sorry, and call 911. And finally, the third step is that there are several diagnostic tests that can confirm a pulmonary embolism. So these will be up to your healthcare provider, and we will walk you through some of these tests so you know a little bit of what you're going into if you do have the symptomology and you do go to the hospital and are discussing with a healthcare provider. So now we'll go into these diagnostic tests. The first one is something called the Wells score. So this is something that was created in Europe, and essentially what it does is it rules out if you have a pulmonary embolism. And the reason for this is that in Europe there was a really high prevalence of pulmonary embolisms, and what was happening was that in the emergency department, doctors were really quick to diagnose something as a pulmonary embolism because, again, better safe than sorry, because it's a fatal condition. Oftentimes, they just deemed it as a pulmonary embolism if patients presented with the symptoms. However, again, this could result in a bunch of unnecessary testing and unnecessary diagnostic testing that might put the patient at a further risk than they need to be. So the Wells score was created to rule out pulmonary embolisms and rule out who was at a low risk. So there's a bunch of criteria you can see on the left hand of the slide. Some of them are if you've had a history of pulmonary embolisms or of deep vein thrombosis, if you have a history of blood clotting, if you have a very high heart rate, and if you have the clinical symptoms of deep vein thrombosis as well. So all these criteria are assigned a specific point, and at the end they're all added up. So if you have a score of less than 4, your healthcare provider will consider a D-dimer test. We'll go into the more specifics of a D-dimer test and what exactly it is. If it's negative, consider stopping the workup. If it's between 2 to 6, consider a high sensitivity D-dimer test or imaging. And if the D-dimer test or the imaging is negative, then consider stopping the workup for a pulmonary embolism and trying out a different diagnostic test for a different symptom for a different condition that might present with the same symptoms. And if your Wells score is greater than 6, then your healthcare provider should consider something called your V/Q ratio, which is your ventilation perfusion scan, or something called your CTPA, which stands for, it's a long phrase, computerized tomography pulmonary angiography. So we will be getting into what the VQ ratio is, as well as the CTPA test, and we'll go into more specifics of that as well. Your Wells score is usually used in conjunction with something called your PERC rule. So the PERC rule is something that stands for Pulmonary Embolism Rule Out Criteria. So again, same concept as the Wells score, where it is something to rule out the chance of pulmonary embolism. So there is a bunch of criteria you can see on this slide. For example, if you're younger than 50, if you have a pulse rate of less than 100, if you don't have a history of thromboembolisms or deep vein thrombosis, if you don't have swelling, so things of that nature. the Wells score and the Park rule may be used to rule out if you will have a pulmonary embolism. However, it's important to note that the two of these tests are only used if you're at a low risk. So for example, if you're presenting with some of the symptoms, if you're at a really young age, and it's very unlikely that you are to have a pulmonary embolism. So these are for low risk patients. On this slide, we have a flow chart of how diagnostic tests are run, and the patients with symptomologies of pulmonary embolisms are usually sorted out into 3 tiers. Low clinical probability of a pulmonary embolism, a moderate clinical probability of a pulmonary embolism, and a high clinical probability of a pulmonary embolism. If you have a low to moderate clinical probability of a pulmonary embolism, your doctor will send you to do something called a sensitive D-dimer testing. So D-dimer testing, if I am to explain it in a little bit of a nutshell, is something that measures the level of D-dimers in your blood. So high levels of D-dimer in your blood may suggest that pieces of a blood clot are loose in your bloodstream. Why is this? D-dimers are one of the protein fragments that are produced when a blood clot gets dissolved in your body. So this is something to look out for, because your D-dimer, if it's present in your blood, may suggest that there is a formation of a thrombus, and if there is a breakdown of a thrombus that is currently in your body. So if your D-dimer test shows up as positive, your healthcare provider will then do something called the CTPA. So we discussed this in one of the previous slides. So this is a type of angiogram which will show your blood vessels in 3D. So this will show if there is a clot present in your pulmonary arteries. So if that is positive, then you do have a pulmonary embolism. But if your D-dimer test and if your CTPA are both negative, or one of them is negative, that means that you do not have a pulmonary embolism. So this is a flow chart that will show you the process of determining whether you do have one and determining whether you do not have one. There are also a bunch of other diagnostic tests that your healthcare provider can do to determine if you do have a pulmonary embolism. So one of them, as we spoke about, was the D-dimer blood test. So this checks if you do have clotting or a breakdown of a clot in your blood. Then CTPA is where you see the blood vessels in your lungs using 3D images. The ventilation perfusion scan, the VQ ratio, is a test that examines the flow of air and blood into your lungs. There's also something called a leg vein ultrasound, which confirms that you have a clot in your leg. And there's also something called ultrasonography. So this will use sound waves to scan the veins in your legs, your knee, your thigh, and your calf, and sometimes even your arms, to check if you have deep vein blood clots. So there's a wand-shaped device called a transducer, and it's moved over your skin, and this directs the sound waves to the veins being tested. And these waves are then reflected back to the transducer to create a moving image on a computer. And the absence of clots means that you probably do not have deep vein thrombosis, and you are probably unlikely to have a pulmonary embolism. One thing that I do want to discuss is the risk of a pulmonary angiogram. This is because although CTPA is the most effective way of diagnosing a pulmonary embolism, this angiogram does not come without its risks. So some of them are associated because there's a catheter that's inserted into a large vein, which is typically in your groin, and it's threaded through your heart and your pulmonary arteries. So if you do have a history of atherosclerosis, if you do have existing cardiovascular disease and other risks that are pre-existing as conditions, this may not be the best option for you. So this is also something to think about when coming to terms with diagnostic testing for pulmonary embolisms. Okay, so now that you know a little bit about how to diagnose a pulmonary embolism and how your healthcare provider will diagnose that. Let's talk a little bit about prevention and about healing and preventing those pesky clots that may travel to our lungs. So one of the most common ways of preventing clotting and pulmonary embolisms is something called an anticoagulant, which is also known as a blood thinner. So most of you may already be on blood thinners, for example, baby aspirin. There's also something called warfarin that is a very common anticoagulant as well, and these medications are often given to people at risk of clotting, and it will definitely reduce that risk. So if you are someone with a history of heart attacks, strokes, or any complications of cancer, you're probably most likely familiar with blood thinners, and these are one of the best ways of modern medicine preventing blood clots. So something else is something called compression stockings. So these are stockings that steadily squeeze your legs, and these help your veins and your leg muscles move blood more efficiently. They offer a safe, simple, and inexpensive way to keep blood from stagnating during and after existing blood clots, during and after general surgery, or even if you've been sitting down for a long period of time. This is a way to prevent that. Leg elevation is also very important for prevention. Elevating your legs when possible, and especially during the night, can be very effective because at night you're just laying in one place for a very long time. So one recommendation is to actually raise the bottom of your bed around 10 to 15 centimeters or 4 to 6 inches with either blocks or books, and these are a way to keep your legs elevated while you are sleeping. Physical activity is also super important. Moving as much as you can, especially if your job requires you to sit all day. If you get up, stretch, walk around, these are very important to keep your blood moving and to stop it from being stagnated in one place. And finally, something that is a little bit less common but just as effective is the pneumatic compression. So this treatment uses a thigh-high or a calf-high cuff that automatically inflates with air and deflates every few minutes to massage and squeeze the veins in your legs to improve blood flow. So think about it as a blood pressure cuff for your legs and your calves, except it's not really monitoring your blood pressure, it's just moving the blood around. And now let's talk about preventing and removing life-threatening clots. So there are three main ways of doing these if you are at a very high risk of a pulmonary embolism and if you have a very high clinical probability of a pulmonary embolism. So the first is something called a thrombectomy, and this is more simply put as a clot removal. So this is where a healthcare provider will physically remove your clot, and that will reduce your risk of having a pulmonary embolism. The second one is something called fibrinolytic therapy, and more simply put, it's just a clot dissolver. So what happens is your therapy for clot dissolving will completely break apart your clot, and it will drastically reduce your chances of having a pulmonary embolism. However, this does come with a risk, and it's just used as a last resort because it can cause excessive internal bleeding, which is something that we do not want because excessive loss of blood would not be healthy or safe for us at all. And the last way to prevent a life-threatening clot that may result in a pulmonary embolism is something called a vein filter. This is where a catheter is inserted in a position to filter in the body's main vein, which is called your inferior vena cava, and this will keep clots from going to the lungs. So that is all for prevention and for some therapies to treat pulmonary embolisms as well as diagnose them. And now Eileen will be touching upon some resources about pulmonary embolisms and how to deal with it if you have pre-existing histories of pulmonary embolisms and deep vein thrombosis.
Thanks, Dia, for that very detailed explanation on what the symptoms are, how pulmonary embolisms are diagnosed, and how to prevent them. I'm now going to go over some of the resources available for patients that have had a pulmonary embolism and how you can further prevent them as well. The North American Thrombosis Forum, or NATF, is one of the many organizations that provide support for patients that have had a pulmonary embolism. In this electronic brochure, you can find preventative techniques and a simple guideline for exercises that can be done to decrease the risk of developing PE. Some of the exercises include strength training, with or without lifting weights, and a SMART goal of walking 30 to 45 minutes 5 to 7 days per week. The exercises are aimed for leg movement since most pulmonary embolisms are caused by DVT, as Dia had discussed earlier. Some of the other resources include a 92-page guide by the Agency for Healthcare Research and Quality outlining detailed preventative measurements for both DVT and pulmonary embolisms. We have also included some links that provide support and awareness for pulmonary embolisms, including Clot Connect and National Blood Clot Alliance. Thank you all for listening, and we really hope that you are now more familiar with what pulmonary embolisms are and how you can avoid them. Please feel free to connect with us if you have any questions by joining our Facebook group online or sending us an email. Thank you and take care, everyone.